Hi guys, welcome back, and let's talk about strengthening your glutes. And why that's important for lower back pain is that your glutes are actually meant to be your largest and strongest muscles in the human body. Today, because a lot of us spend way too much time sitting and just being inactive, those atrophy. They get weaker, they get smaller, and then other muscles have to take over for the job that the glutes are meant to do. And a lot of times that goes straight into your lower back. So when I'm lifting off of the floor, instead of using my big strong glutes and hamstrings, my leg muscles, then I'm instead picking stuff up with my lower back. And that over time can cause some discomfort or even acute injury where you throw your back out. So today I'm going to show you a couple exercises to strengthen your glutes at home, no equipment necessary. The first is called a glute bridge. So we're going to lay down on our back. Okay, we're going to find a nice comfy spot, lay down on our back. I want your head rested against the floor. And just like when we reviewed the bird dog and the dead bug exercise, I want you to think about pressing your belly button into the spine. Okay, I want your feet flat in the floor. Okay, I want them, toes pointed straight forward, and back flat on the ground. One thing I see a lot is when people tilt their hips up and then they have this round in their lower back here. So think about tucking your pelvis underneath you like such. Okay, make sure your lower back is pressed on the floor. Then what you're going to think about is I'm going to press my whole foot, not just my toes, not my heels. I'm going to press my whole foot to the floor while I maintain my pelvic tilt. I'm going to press my whole foot to the floor and I'm going to lift my hips off the ground. You should feel a nice squeeze through your glutes, maybe into your hamstrings and your lower leg. And then you're going to slowly come back down. Press your feet to the floor, lift, squeeze, slowly come back down. Okay. That's the glute bridge exercise. It's really important in that exercise that you feel that movement engaging through your glutes. And if you have some trouble with that, we should practice that core stability in the pelvic position. So that's exercise number one. That's for your main glute muscles, the glute maximus and the hamstrings. But there's also another smaller glute muscle on the outside of your hip called your glute med. It's really important that muscle is also worked and exercised as well, just because in our daily life we don't use it that often, but it's an important muscle for stability. So the second exercise we're going to show you is called a clamshell. We're actually going to lay on our side with our legs tucked up next to us. Okay, I want your heels together and your legs back. Okay, your heel should be aligned with your butt. Okay, you're gonna keep your hips forward. Though what I don't want to see is your back and your hips opening up. I want to keep my hips closed, and all I'm gonna do is just lift off here, and then slow on the way back down. If you need to, use a pillow to support your head. I don't have it. I'm feeling pretty fine supported. My neck feels fine. But if you have any neck pain, go ahead and use a pillow. Lift that leg up. Squeeze. You should feel that right here. And nice and slow on the way down. And again, don't open up your hips as you go. Keep your hips closed. Keep your chest forward. And just lift through the hip. And slow on the way down. Do a few sets. I like 10 to 12 repetitions. If that's really challenging for you, start with just a couple. Tomorrow, let's maybe jump up to 5. Next week, let's jump up to 7, and work your way up to 12 to 15 reps. Again, neither of those exercises should be uncomfortable. It shouldn't replicate any back pain, and if it does, we may need to back off and try stuff that's a little bit less aggravating or a little easier for you at first. If you have any severe pain, you should definitely seek some medical help, physical therapists, maybe talk to your primary care provider about it. And if you have any questions about those, let me know. Thanks.